Should we have molecular tumor boards in every hospital or use digital platforms to share expertise across all hospitals?
Welcome to Dr. Sudha S. Murthy's Precision Cancer Question, where we challenge the status quo in cancer care, one question at a time.
A district cancer center in India diagnoses a young woman with metastatic colorectal cancer. Her tumor shows a KRAS wild type profile on a small NGS panel, but the clinical team feels unsure about therapy sequencing. There is no molecular tumor board framework in the hospital. A molecular tumor board or MTB is a specialized meeting where experts come together to interpret a cancer patient's genomic and molecular test results and decide how those results would guide treatment. Think of it as a multidisciplinary decision room comprising of oncologists, pathologists, radiologists, genetic counselors, molecular biologists, bioinformaticians, and sometimes clinical trial specialists. The MTB reviews NGS reports, looks at germline findings if relevant, immunotherapy markers, and liquid biopsy data if available. Then they provide a consensus recommendation that helps oncologists choose the best targeted or immunotherapy approach for that specific patient. Now, large cancer centers argue that MTBs must be mandatory, structured reviews, evidence based recommendations, and multidisciplinary consensus. But most small or rural centers simply can't support full time molecular teams. If we enforce mandatory molecular tumor boards, do we create inclusion or quietly deepen inequality? Precision oncology thrives when genomics, pathology, radiology, and therapeutics converge. But studies show that 50 to 70% of cancer centers in low and middle income countries lack a functioning MTB, and even in developed countries, molecular tumor board participation varies widely. Digital MTBs, asynchronous e-consults, and shared case repositories can now provide the same depth of insight with dramatically low barriers, often reducing the turnaround time. Precision cancer care must move from exclusive rooms to inclusive networks. The real mandate is not molecular tumor boards themselves, but equitable access to expert thinking. So today's precision cancer question is: should precision oncology enforce mandatory tumor boards or empower digital networks that let every patient access expertise wherever they live? Till the next time, think, act, and react. Please hit the like or subscribe button to let these kind of questions flow. Thank you and bye bye.